Universal insurance, dental, precious insurance. There is so many insurance, and blue, red, green, derby, so kind of these insurance. It's getting to be, oh wow. Mark Manhart here at calciumtherapy.com. I want to talk about dental business and what people like Mary Kay have to do at the desk here, or the things that they do, and what we're kind of used to, and how we're adapting to uh, the high tech stuff. Well, when insurance came out, we had to adapt to that. When the dental insurance came out, when you're dealing with dental insurance, be careful and be look at the details of this, whatever kind it is. Look at the details so that you know, when does it kick in, and how many months do you have to wait? Uh, because it gets very complicated and things are delayed. Uh, I remember when insurance companies came in, why did they start covering dental care? I think it was kind of this way, where the actuarials of insurance are just smarter. They know business. And so they figured out that here's dentistry, and when people go to the dentistry and have their work done, and it's done really well because they're just doing their job very well. They, the patients would need insurance, and they would pay premiums for their insurance. But as the years went on, they needed less and less dental work, but they still paid their insurance policies. And so we used to be asked once in a while, hey doc, I've had so much dental work done. I'm doing fine. Everything's working out good. So do I need insurance for my teeth? And actually, I had to tell them sometimes, Jack, you are in great shape. You're 61 years old. Uh, Cut back on the insurance because you're not going to need a whole lot. And that made a lot of sense to some people. Well, what's happened over the decades here, that situation changed because people would have a lot of dental work done and they would pay their insurance. And then when they get to be 65 or something, they need more dental work done and they need to do all of this stuff over because it's old or because it's not lasting over 5 years. What do they say? Composites last 5 years. You have to have it redone. Gum surgery lasts you 3 to 5 years. Then you have to have it done over again. Well, that's kind of telling me, wait a minute, how do we justify our insurance coverage? See, that's something that in the dental office that has to be handled right here at the desk. And it goes on all day, every day. Another thing that happens here is new patients that come into the practice. How do you have new patients? I remember there was a guy. This was a true story that he in New York or someplace like that. He would always be in the balcony of the baseball field, right in the front row, and every once in a while he would throw out a few of his dental cards, personal cards. Well, it was his great way of advertising, and it worked really well because he made them so that they would kind of float down and somebody would pick them up and come to his office. It's very clever. Well, if you find a practice, and this is my own contention, is, and you just can't get in, uh, it works like this. You have to have this done. You have to have this done. Okay, now get an appointment in 3 months. Oh, no, no. if you're a smart person setting up appointments, you always leave a little room for those emergencies so that you can take care of the patient's immediate things and then see them in 2 months or whatever. And that's it's not a game, but it's a smart thinking kind of thing. And every kind of different kind of dental practice is different. Like a orthodontist appointments and how they're made, that's special. An oral surgeon, that's different. And a general practitioner, you have to be ready for everything that comes in the door, everyone that comes in the door, whatever the problem is. And so in our situation, we have to be ready for how to arrange an appointment with somebody coming in from London, or somebody that's driving in from Florida. We had somebody drove in the other day from what is Scottsdale, and they stay, and so we have to help them make arrangements for when the appointments will be, how long they will be, where they will be staying, whether they're going to get a car, whether they might need, so a lady came in from Wisconsin. She was so terrified about getting on a plane and coming, she said, is there any way I can get from the plane to your office? So we went out and picked her up at the airport. Well, those kind of things we have learned how to deal with. And also when people come in and stay overnight, they come in and stay 2 nights or something, we try to arrange some entertainment for them, take them to dinner. When Bonnie has a gig or something, they come and hear a concert or see a movie. And it really that's part of the atmosphere, the way things work in our office. And we have to plan people. When somebody's coming in from New Zealand, you have to have things planned very well. Well, if you have somebody coming in from down the street and their time is just more valuable than my time, you have to make plans for them and make things flow together as if, oh, it's just another day. And the last thing was, we have a website that we even do seminars on the website. And we get so much email, we have to learn how to handle that. And here's a very neat thing that we do. If I'm not busy and somebody calls from California or Canada, they want information, we give them information. And that information might be me on the phone. And if I've got a few minutes, that's me on the phone with them. And boy, do they appreciate that. They say, oh, is this doctor? I didn't mean to disturb you. Well, hey, what's the problem? Let's get at it. So the business of running a dental office is pretty darn complicated. So when you go there, have a good time, and remember, take 26 seconds before you decide whether you want to stay or come back. Thanks for coming. This is Mark Manhart, calciumtherapy.com.